There is a very good value in these LLMs and AI where there's more authoritative, more specific answers that you're going to get.
Fundamental foundational basis of healthcare is really having equal information between what the physician is telling you and also from your own research.
The thing about ChatGPT I really like about is they went into the real use cases. Patients and consumers engaging a lot more into their own health and making informed decisions. Everyone thinks about the AI is coming into healthcare and start actually replacing doctors. That is actually... This is a weekly show where we break down what's actually happening at the intersection of healthcare technology, artificial intelligence, integration, business, entrepreneurship. Each week, we analyze real product launches, real company decisions, and real shift in healthcare technology. Not in theory, not in hype, but in production. I'm Ashok Gupta, doctor of physical therapy by education. I build healthcare companies and AI inside real health systems. I work hands-on with the epic clinicians, workflows, compliances, and integrations. And I spend most of my time figuring out what actually survives once a product leaves a demo environment.
Yeah, that's great. And my name is Gunwardeep Singh. I've spent my career in healthcare tech, building and working with companies at the intersection of healthcare, technology, and entrepreneurship. My focus is on how digital products actually change patient experience and how these lofty concepts that we see in headlines survive in contact with real-life use cases. Our focus and my focus is on AI systems and platforms, how these models are evolving, and how architectural and design decisions shape outcomes, as well as where is this technology headed in the future. In the past week, coming out of the JP Morgan Healthcare Conference, two of the biggest AI players in the world, OpenAI and Anthropic, launched products that aren't just for hospitals anymore, but they're tailored specifically for patients. So ChatGPT Health and then Claude for healthcare promise something that healthcare really has never offered before, which is a way to understand your own health in plain language. So really distilling down the information that you receive from your physicians, from your various providers, and putting the power and the tools into the hands of the patients. So there's a few demos that we're going to walk through, a few different pieces of news that have come out recently. And we want to talk through essentially how that impacts the patients as well as the provider space.
Well said. That's so true. This is a very critical time in the healthcare and artificial intelligence. Technology is leaping forward. Let's just see what ChatGPT has to offer. I'm going to go ahead and pull up their presentation. I hope you can see my screen.
I've got 15 minutes and want to squeeze in a workout. What can I do with a set of 10-pound dumbbells?
When you live with chronic pain, they think it's all about symptom management.
I'm having an endo flare-up today. What are some simple things I can do to help me feel better?
Enjoy. I can take a picture of the plate before and after the meal, and it will calculate the calories and the inflammation score for that meal.
I invented a metric called burntness, which was how much of myself am I feeling.
That was something
impactful. So I think they touched on a lot of pretty key topics, right? So you see a lot of those examples of patients saying that they now have the power in their own hands. They now have the tools to access information that they may hear from their physician when they go for their doctor's visits. But now it's taking a step beyond just the information that you're receiving in one direction, right? I trust what my doctor is telling me, which is a good thing. And I am taking that information, doing some minimal research, but depending on the condition, and taking that information to make an informed decision later on. Key fundamental foundational basis of healthcare is really having equal information between what the physician is telling you and also from your own research, as well as the physician isn't holding anything back from what they're going to be telling you. This has a lot of positive impacts, from my opinion. It leads to a lot more informed patients, a lot better questions that are coming from the patient side, and then higher expectations of healthcare. A lot of what we see today is, you'll go to a doctor's visit and the majority of that encounter with your physician is going to be more educational, informational of this is the information that I understand about your condition. But now this allows you to come to those visits with some research in hand, some tools with you, and essentially a co-pilot for your own healthcare. But curious to hear your thoughts from a clinician's perspective and how, the treatment for patients might differ from that side, and take it from there.
I'm excited and anxious at the same time. Clinician in me is thinking about now we'll have to talk to the patients. Like, you remember the era of internet when patients started Googling and then bringing printout of questions. This had happened before, but I'm more excited about like now the questions will be a lot more tailored. They'll be more intelligent and more specific about their conditions, not like after 5 minutes of Googling, everything ends up to being a cancer. Another thing about ChatGPT launch I really like about is they went into the real use cases rather than this is one product solves all solutions, and then from tomorrow you can get your whole healthcare on ChatGPT Health. Instead of taking that approach, which generally the smaller startups usually do, they have shown maturity, and I can see they have taken a specific steps about educating what that real use cases would be. One of the use case about like just clothing, not always that has to be a other doctor in the play, and then you're preparing yourself. You're buying clothes, and then you're allergic to a specific allergen. Now you can take a picture, and then now LLM can actually tell you a little bit about that, and you're making a safe purchases for yourself. You're eating foods, you are able to measure some amount of calories out of it. That is a way we can see patients and consumers engaging a lot more into their own health and making informed decisions. On the clinical side of it, I am very cautiously optimistic, and I want to see how it unfolds over the next couple of years and how these experiences will look like. But that's not all. That's ChatGPT Health.
So you did touch on a really good point there. Before we hop over to Claude, I think there's a really good point you brought up about company launches and how they're sometimes overpromising, especially in the health AI space, in this so-called bubble that we may or may not be in. What you see a lot of the times is when companies are presenting this is a new AI tool or a new piece of software that they're bringing to the market, they talk a lot from the tech perspective as to these are the connectors that we're making, these are the different sources of information, right? But what OpenAI did really well here was they are showing specific use cases where patients, like myself, can go and upload results, search about a diagnosis, and that way I'm getting more information. I'm more informed or better informed before I go to meet with my clinician. I have a couple of questions that I think it would be good to get your perspective on. One would be, if you recall, like the use of WebMD. I think that started to decline a lot over the years because people were using WebMD. They saw that it really exaggerates the condition that they have, and they were over-reliant on that. AI has entered the space in the last few years, specifically in the healthcare space, and responds to your prompts with a very authoritative statement of this is the diagnosis, this is the prognosis, and this is what I would recommend. What are your thoughts on patients' over-reliance on AI as a clinical decision maker, and how does that impact the relationship there between a provider and a patient, and how do you see that dynamic shifting with these new tools coming into play?
That's a great question and perspective. Google, WebMD or Google always leading to like possibly it could be. There is a very good value in these LLMs and AI where there's more authoritative and more specific answers that you're going to get. And then now in this era, this 2026, what's happening now is like you're able to get your custom personalized data added to the model via these connectors that you just talked about. The simple example is like having your mobile health, your Apple Health connected to it. So now these models are able to see how much are you walking, how well are you sleeping, and then be able to respond beyond that. That's amazing. That's very, very forward in terms of like a healthcare and then the level of care we will be able to provide. But what actually worries me the most is the LLMs do hallucinate. We haven't solved that problem as of yet. Mm-hmm. In every part of the application of AI, one of the problem is if the LLM does not know something, it will make it up. How much ever with system prompts or rules, you try to build controls, but still that happens. As of today, it still happens. And if that happens in healthcare, it can be very detrimental. There are many use cases can be talked about where AI can give a wrong guidance. A small thing like if it says a skin rash is an eczema is something other, totally fine. They'll get to the doctor and we will resolve that. But sometimes if the clinical decision making is done based on the AI model's predictive or analysis, you can really cause irreparable harm to somebody. Our faith and trust in this new technology will deteriorate pretty fast. So that will be very critical over the period of time to see how well these models are. Yeah. And one more thing that comes to my mind is like when we talk about healthcare, everyone thinks about the AI is coming into healthcare and start actually replacing doctors. Mm-hmm. That is actually not true. majority of applications up to this point were built in artificial intelligence. They were all actually solving the pieces of the puzzles. They were just making the healthcare a little bit more efficient and a little bit more effective. They were all after the care was already provided. Now the shift is happening where the AI is being implemented at the point of service. Or this is a great shift. It is actually even before the point of service. It is the patient is preparing themselves with their own data. Sometimes I also revert back to the invention or innovation from Apple when the EKGs were implanted in your Apple Watches. So great shift. A lot was talked about it that will change the world, the way the cardiac health will be. But we all know today, we all still go to the doctors and we still have a lot of angioplasties happening out there.
It's true, yeah. Yeah, I mean, a lot of the technology that we've seen in the last couple of years, at least, has been how do I alleviate the burden that's on physicians or on clinic offices so that it makes their day-to-day work a lot easier, right? So a lot of the tools that have come out are tailored towards, okay, how do we automate calls, right? There's a few different AI companies, not even Anthropic, but there's a few others that are solely specifically working on automating calls for patients, automating the administrative tasks of insurance verification and so on. But now it represents a shift towards, okay, this is putting a tool that's specific to be a patient co-pilot instead. So now the patient has similar tools or similar access to resources that the providers previously had. Right? You mentioned one risk, and that's sticking in my head to that hallucination, right? Whenever a patient is interacting with these AI models, it really requires two elements, right? One is that the patient is providing enough context so that their prompt is usable, right? If there's enough data from previous interactions with this same string or same model that it knows what to look back on. And the second piece is the patient should know essentially, or should essentially train themselves to look out for points where there is potential hallucination of, oh, I didn't necessarily provide that information. Where is this assumption coming from, right? And that's, I think, what the biggest risk factor is for this shift towards patient models, because a lot of the users or everyday users, weekly average users that are interacting with models like ChatGPT are not necessarily tech savvy or don't work in the tech space altogether.
ChatGPT or all these LLMs, they have been giving out these legal disclaimers. Regardless of that, people have been using them for almost a couple of years now. All what's happening at this point of time is they're just getting better because you're providing them better access to the data. So I'm excited about talking to you about Anthropic and Claude. So we see that like at JP Morgan Chase Health Conference in San Francisco, they released their own version of Claude Health. So let me pull it up and I want to hear your take of it as a consumer. What do you think about all these connectors they're offering out for the consumers to connect to Claude Health and ask questions?
Let's do it.
Here you go. This is their one of the first release. And why don't you take it up?
Yeah. So from my understanding of this, from some of the articles that I've read about it, from this demo that I've seen as well, there's essentially 5 main elements that they presented with this Claude for healthcare is, I believe, what it's called, right? They talked a lot about both the provider benefits or organization benefits, as well as the patient or consumer benefits. So we'll talk a little bit about the provider benefits, and then we'll really focus in on how does this benefit the consumer themselves, right? So from the provider side of things, I saw that they had come out with these MCP key connectors for prior auth, for ICD-10, FHIR connectivity, and that kind of falls into those 2 buckets. And then for life sciences, I'm glad that you brought that up immediately, there was the ability for, providers and research organizations to digest, understand clinical trial protocols, draft new clinical trial protocols, and then also prep for regulatory submissions. When you're submitting paperwork or you're submitting your documentation for clinical trial, this is going to be a big tool that helps you out in that space.
See, I have seen a lot of models, even like not from these big players like Anthropic and ChatGPT, but more dedicated applications have been built over the last couple of years related to these operational efficiencies or clinical researches. These models are very fine-tuned with the data. What ChatGPT and Anthropic has done is like build these extra connectors so they have a lot more of knowledge base. and a very specific fire engine access. Why don't we talk a little bit about the approach these two companies have taken by integrating directly into the fire engines? And we've seen that happening a lot more. Health, ChatGPT Health has taken an approach of buying a company, Torch Health, and they're able to perform those similar actions via that, or the intentions would be probably, versus Claude Health is taking a little bit different approach with HealthX integration. So what's your take on that?
Yeah, I mean, it might be helpful to frame it, like take a step back and talk about like fire in general, right? Fast healthcare interoperability resources. And I think that's going to be pretty essential for connecting pretty much any organization together with a standard format. So previously...
And Conrad, before we dive deeper, go further in it, for our audience, would you want to explain a little bit about like, what this integration and interoperability is, like when it comes to access to an HL7 engines or fire engines? So a little bit brief introduction to that will help understand for other applications that want to integrate or they're building in a similar domain or people who are just interested about it.
Yeah, absolutely. For the last 20, 30 years at least, the healthcare ecosystem, at least from the tech side, has been pretty reliant on HL7 protocols. So that's Health Language 7, I think is the breakdown of that, where it's a standard communication format for any patient records when it comes to like orders, patient administration, demographics, any scheduling resources between two systems. But essentially, it's a language that allows two different healthcare systems or two different softwares to link up specifically with their integrated languages, right? Fire has come up in the last few years as a more efficient format to transfer a lot more data. So most health systems, most EMRs are now using Fire APIs as their primary mode of communication when they're communicating with external organizations. So these resources now establish a better standard format for all of the patient documentation, patient history, any orders, surgeries, any scanned PDFs, and so on. It allows for one organization, completely unrelated to another, to package up that patient's information into one communicable language and transmit that over to another system. And I think that's exactly where Torch comes into play. And we can talk a little bit more about how Torch plays a role here.
Right. Yeah, that's very helpful. At least like from the fire perspective, what we are seeing is more and more healthcare systems are more open to opening to their data interoperability, and building applications around a fire has been on uptrend. So this is a good positive move towards like being able to pull your medical records from the healthcare system that you go to already, and then giving that to the large language model along with the information and the questions. A lot more context, and definitely that's going to provide a lot more better results in terms of the information it'll provide you back as a consumer. Not only talking about these operational efficiencies and different integrations, we have seen on the consumer end, Anthropic has taken a different approach, a little bit of taking all the consumer-centric applications and then putting them into the Claude itself via the Claude app, regular app itself. So how does like me as a user downloads a Claude Health app? How do you see I'm an iPhone user, I already have my health kit, I have my Aura Ring that actually gets all my data over to my health app. Now, how does that actually like transfer over to Claude? And then that Claude would be able to use that during the prompt or chat that we are going to have.
From my understanding, I think, and I haven't had a chance to play around with it yet, but there's a way for you to set up like integrations, right? I think there's a standard format of if you allow your phone to use data from your Apple Watch or your Aura Ring, like you mentioned, as soon as you download that Claude app, you're allowing you can choose to allow access to interpret and pull in that data. As it's read from your Apple Watch or Aura Ring, it's just going to be raw data itself. But let's say you are interested in ways to better improve your sleep or better improve your overall like cardiovascular health. One good use case that I can think of right off the bat is, let's say you get lab results back, you have, elevated cholesterol or something along those lines that you want to start to correct in addition to whatever medication you're using. One use case that I can immediately think of with Claude is I upload these lab results. I say, this is my condition, this is my history, and this is the medication that I was prescribed. This is the impact that it's having. Connect to my health app to get a better understanding of what my daily mobility is or what my daily activity is, and suggest ways that I can set measurable goals for me to improve my health outcomes through the mode of, my exercise in addition to the medication that I'm taking. right? And this allows that large language model that Claude for Healthcare is using to pull all that data from your Apple Watch or Oura Ring and incorporate that into, okay, today you're doing 5,000 steps a day. If you slowly ramp that up to, let's say, 10,000 steps a day, that'll significantly increase your ability to reduce your weight or, address your current health problem. I think that's going to be a really, really crucial part of it's taking a little bit of that data interpretation out of the hands of the patient and allowing you to have digestible and actionable ways to improve your health.
No, that's a good, valid point. But I do want to bring up two different points now here. Sure. Now, the first one is, how's this any different than what's already happening out there, other than just the big two giants? Big techs are actually like stepping into. We already have applications out there. They integrate directly into consumer data like HealthKit or Android Health or other applications like that. Now, and we already have a lot of fitness and healthcare. And one of the great examples is remote patient monitoring and remote therapeutic monitoring. In remote therapeutic monitoring, the applications like Theranos, for example, that I personally worked on, is able to leverage the data from the patient's mobile phone and HealthKit and then connect that and correlate to the other data points that it is already getting into the application. I want to talk two things, actually. One is a little bit more juicier, and then one is like, just see, is it really as big of a deal as everyone is trying to make? It's just because the big tech came into the play. We already have applications for many use cases. One of the example, I personally worked on remote therapeutic monitoring. The application that there are now, we were able to have the consumers, patients download the application, and we were able to integrate directly and collect the patient's mobility and steps data, correlate that to the patient's home exercise program data, and then be able to actually reflect the direct impact of physical therapy in their day-to-day life. At the same time, all this information has to be paid. So the remote therapeutic monitoring under the CMS program is a paid program. So when you're need to bill, you need to push it back into an EMR. In this example, Epic for working in the healthcare systems, pushing that information, being able to bill and get the payment on. You leveraging same HL7 or Fire, as you said earlier. Yep. So how are you seeing this as a shift in the entire industry, or something like going to the Mars type of scenario, how it's being a lot talked about today? So that's the first thing. And then I'm going to talk about a little bit of a conspiracy theory type juicy stuff.
Okay. So the first thing that comes to mind is it's a matter of like the frame of reference that you have access to today, right? When you are integrating directly with Epic for remote therapeutic monitoring, you're pulling just the health records that are out of Epic, right? Epic, to be fair, has a great system called Care Everywhere that connects other Epic Health organizations and pulls all that data into one consolidated patient chart, right? So if I got treated at Mount Sinai, but also got treated at some other health system over on the other side of the country, they're able to consolidate those two records and make sure that I have enough information to then relay out to this external system, right? Yeah. I think where this shift is happening is going beyond just one ecosystem and allowing you to access data just from that one ecosystem. But now with these standard interoperability frameworks, you are now taking data that if I got treated at this small clinic and that small clinic, and they all operate on different EMRs or different systems, with these connectors, I have the ability through Claude to now connect with those old systems and pull that data over. This is ideal case a few years down the road, or maybe a year down the road, where now I'm able to collect information from my own records from all these different sources and put that against the data that I'm, downloading from my Apple Watch. All of that together is now a much more meaningful picture of me as a whole person with all of my care, rather than just one source of information directly from one central EMR itself.
Makes sense. Yep. So it's just like more sources of data is what we're talking about, and access to more data because of them.
Absolutely.
Right. I'll get into the juicy part.
Let's hear the conspiracy theory. Yeah.
So ChatGPT and Anthropic both actually talked about we never use patients' data to train our models. Mm-hmm. They do not run their own health system. They do not run their own patient applications. And that means either the models behind this is the same ChatGPT 5.2 that is able to write a Facebook ad, and then it's the same model with trained on the internet data, or they had access to some privileged private data to train these models to be able to interpret this more. And then before you even go and start talking about where did they get the data from or how was the models were trained, we should also talk about the other companies. They may not be as big as ChatGPT or Anthropic, but they actually own the data, the health systems, or the applications that actually have a specific type of patient data for that example, because they were in that domain for 20 years now. And then they've been operating under that. And then they have thousands and millions of patients of data on that particular segment. Aren't they in a better position to be able to train their own model and then actually provide the similar services with a lot of connectors versus ChatGPT or Claude that is actually using a generic model, and then depending on the good context, good input, to be able to provide a good output?
That's fair. I mean, you bring up a good point. If you are the owner of the data, then you probably are in the best hands to build out a model that is using that data to then create essentially your version of Claude for healthcare, right? But I think it's a matter of like where the talent lies itself. A lot of these, health systems or organizations that own a lot of this data aren't necessarily diverting resources to start up their own incubator program that is solely building an LLM, right?
Well said. On the developer community, there's one thing has been actually promoted and appreciated a lot is these open source models. When the AI a few years ago was talked about, it was all about, do you have resources, power, and economy of scale to be able to build your own large language models? But in today's world, one can argue that we can take these really amazing, forward, intelligent, large open source language models with even reasoning capabilities into it. If I'm an EMR, I already have this much of information. Now I can have my own private LLM and then be able to fine tune it. And then with all the connectors, with all the data points that we can input in the context, I'm going to be in a much better shape. If not much better shape, it's definitely going to confuse a lot of health systems or EMRs to whether build or buy.
Yeah. I think it's a very fair point, right? And I think that's where this conversation about data governance really comes into play. I guess in the last 2 years or so, there was a big push from the government essentially to limit how much actual patient data was used to train these models, right? I think since this recent administration, a lot of those guidelines have been eased or pulled off entirely. So I can definitely see that happening where these EMRs are now given the green light to go ahead and develop their own thing. Can't necessarily predict one way or the other, but I think that's where that data governance comes into play, and probably we need to research a little bit more into that. It could be a good topic for another episode too, about how this data governance has changed over the years and how this is impacting the current space that we're seeing.
Definitely. I would be curious to see how these two big giants killed a lot of startups over a couple of weeks, and how are the big EMR systems are going to lock them out, or they're going to play along with them. So it would be a very curious thing to follow along.
Yeah.
Alrighty.
All right. So I think we left it off with why this matters, what we've been talking about for the last 30 minutes or so. What is the actual impact on the healthcare ecosystem as a whole? And I think what would help with that is talking through some metrics that were released by OpenAI surrounding why this whole concept of AI in healthcare has not been something that is brand new. It's not that it's coming. Last week, OpenAI released this report regarding ChatGPT usage as it pertains to healthcare. And that was the foundational basis for why they created this new healthcare specific model. 5% of all ChatGPT messages globally are about healthcare. This is pretty staggering given the fact that there's around 800 million weekly active users globally, with 1 in 4 of those weekly active users prompting about healthcare each week. That's a pretty significant portion, and that was one of the big drivers of why OpenAI had decided to go this route. And a key piece that I think is pointing towards the fact that people are now leaning on this concept of searching OpenAI or ChatGPT specifically about their own health conditions is that the majority of these prompts were outside clinical hours. 55% of those active users explored symptoms or searched ChatGPT for their symptoms outside of clinical hours. 48% of them used ChatGPT to understand medical terms, and 44% of those patients had used it to learn about treatment options. So this is showing a shift towards this concept that patients are now learning or using ChatGPT as a form of searching about their own conditions and now incorporating their own health history into this. But curious to hear your thoughts on essentially these numbers, what it represents about this shift towards this space.
Right. No, that's very insightful. I thought it would be big number, but this is surprisingly very big number. My interpretation of this data is like, it's already happening. Even when the health, all these big tech companies said, we are not a healthcare advice. We are not legal advice. We are not a financial advice. And then still people knowing that kept on asking these questions to this ChatGPT. Now, at least the responses are going to be more correct. And because of the better context, all these connectors and all the other contextual information that we will be providing to the application will definitely make it a lot better. I am very curious to see how this will shift our clinical practices. Our clinical practice did change a lot over the period of like time. Especially, I want to reference back to the point when Google was on an uptrend. People would Google everything. Google it was a term, and patients did that. And then when they walked into the clinics, it was a different experience, a lot different than 30 years ago or 40 years ago when the internet was not a thing. We have been living in an era where patients are educated. They are involved in their healthcare. Now they have a better place and more relevant information to come to these sessions. From the context of physicians, we always thought about helping patients and having the patient involved. I'm very optimistic about the one fact that like patients may respond better to the treatments because majority of the disorders or diseases that we are in today are controllable. A majority of the disorders that we are dealing with today are lifestyle disorders. Some changes to that. So maybe not only a physician or a mom and dad, now ChatGPT can also help you do a behavior modification. On the flip side, the clinicians will have to think a little bit differently. Is like now patient already has done their part of the research and they'll have to acknowledge that. And they'll have to respect the patient's freedom of getting information. But at the same time, big tech need to take the responsibility of actually releasing features that are appropriate, because this will be the clinician's job at the end of the day to keep correcting the patients on the mistakes made by the big tech. There's a positive, and at the same time, there is a word of caution out there too.
Yeah, 100% agree. Yeah, I think you touched on it well. Like long-term outlook, if we look at how this is impacting the healthcare space and how this AI tech will be incorporated into it, I think there's a few points that you brought up I'd like to echo. One is that I don't think doctors are going to be replaced. This is a good tool that will make patients more informed, but at the end of the day, they are going to come right back to the doctors, and doctors will give them their own like clinical insights and guide them the right way. That there is now a responsibility that's borne by two elements of this whole game, right? One is that tech companies, specifically, Anthropic, OpenAI, and so on, need to understand the way that people are interacting with these models is that they're leaning on them pretty heavily for medical advice, for clinical advice, and unfortunately for clinical decision making, right? Although they have those warnings that they put in place, it's still getting overlooked by a patient, and they're essentially treating it as this is advice that I want to move forward with. The second piece is a little bit of the onus is placed onto the patients as well. They're entering in prompts to ask, what is the treatment outlook for this specific condition? We as patients, we as consumers of healthcare need to understand that the contextual information that we need to provide the model just as important as the response that we get. And so if we're only giving a little bit of information, we're not really going to get what we're expecting. And also take all the piece of advice with a little bit of a grain of salt, understanding that there are experts in the space for a reason. We want to make sure that those experts remain experts, essentially.
I'm glad you touched on the responsibility of the consumer also, which in this case is the patient. They are at the center of this entire innovation. Looks like before we conclude our today's episode, we should also talk about two more stakeholders. They will play and definitely will play a very big and integral role in the healthcare innovation, which is health systems, EMRs and EHRs are the shepherds of the data. So let's discuss that real briefly. And with that, we're going to bring our episode to an end today. Let's start with health systems. So what do you think how health systems will prepare themselves for this innovative change, how the patient is taking more center and forward role in their own care? So let's start with that part first.
Yeah, specifically like, let's say a patient is coming in for care. I think health systems, more specifically like providers within those health systems, need to recognize the shift that a lot of these patient interactions are going to be less informative, or kind of this patient is coming with more advanced knowledge, right? And I think that'll be an important component of this whole network, how much data governance issue there is around data security and using this data in training models, a shift in data governance practices for these larger health systems, and how they implement these AI systems safely into their day-to-day workflows, right?
Makes sense. Yeah, data governance. That might be a topic for one full day. That definitely we can talk hours about that for sure. That's amazing. That's very insightful. It was a great chat talking about this 2026, bringing patients as a forward into the healthcare partnership, and I'm looking forward to how 2030 will look like, and would that be any different than last 5 years or last 10 years, or is just an incremental change?
Yeah, I'm excited to see what comes and more episodes to come too. Yeah.
We will be here.
Yeah.
Thank you.
All right. Thanks.